1. Anxiety disorders. Generalized anxiety disorder, GAD. GAD is characterized by constant, excessive worry and anxiety that are often unrelated to specific events or situations. People with GAD frequently feel overwhelmed by minor issues and struggle to focus on daily tasks. This condition can be exhausting, both physically and emotionally, often hindering normal life. Panic disorder. Panic disorder is marked by sudden episodes of intense fear, often accompanied by physical symptoms such as a racing heartbeat, shortness of breath, and dizziness. During an attack, people often feel as if something terrible is about to happen, even though there's no real danger. Social anxiety. Individuals with social anxiety experience intense fear in social settings, worrying about judgment or embarrassment. This can interfere with public speaking, meeting new people, and even daily interactions with colleagues. Obsessive-compulsive disorder, OCD. OCD is characterized by intrusive thoughts, obsessions, and repetitive behaviors, compulsions, that a person feels compelled to perform to relieve anxiety. This might involve actions like constant hand-washing or repeatedly checking that appliances are turned off. 2. Depressive disorders. Major depressive disorder. Major depressive disorder involves prolonged feelings of sadness, hopelessness, loss of interest in favorite activities, and low energy. People with this disorder may lack motivation, making even the simplest tasks feel challenging. Dysthymia, chronic depression. Dysthymia is a chronic, but less intense form of depression that can last for years. People with dysthymia often experience a persistent low mood, though symptoms may be less severe than in major depression. 3. Bipolar disorders. Bipolar disorder types 1 and 2. Bipolar disorder is characterized by alternating manic and depressive phases. During a manic phase, a person may feel extremely energetic, excited, and sometimes engage in risky behaviors. The depressive phase brings on the opposite feelings of sadness and low energy. Cyclothymia. Cyclothymia is a milder form of bipolar disorder, involving mood swings that are less severe but still disruptive to stable functioning. 4. Schizophrenia and other psychotic disorders. Schizophrenia. Schizophrenia is a serious mental disorder involving distorted reality, hallucinations, disorganized thinking, and abnormal behavior. Symptoms can include hearing voices or feeling threatened when no real danger exists. Schizoaffective disorder. Schizoaffective disorder combines symptoms of schizophrenia with mood disorder symptoms, like depression or bipolar disorder. This can complicate treatment and requires a comprehensive approach. 5. Eating disorders. Anorexia nervosa. Anorexia involves extreme food restriction and an intense fear of gaining weight. People with anorexia often have a distorted body image, seeing themselves as overweight even when they are significantly underweight. Bulimia nervosa. Bulimia involves episodes of overeating followed by attempts to compensate through behaviors like vomiting, excessive exercise, or using laxatives. Binge eating disorder. People with binge eating disorder frequently consume large amounts of food, even when not hungry. Unlike bulimia, binge eating disorder does not involve compensatory behaviors like vomiting. 6. Stress and trauma-related disorders. Post-traumatic stress disorder, PTSD. PTSD is a condition that arises after experiencing trauma, such as violence, war, or disaster. People with PTSD often suffer from flashbacks, nightmares, and a sense of detachment, which can severely impact their quality of life. Acute stress disorder. Acute stress disorder is similar to PTSD but usually occurs immediately after a traumatic event and lasts for a shorter period, typically a few weeks. 7. Personality disorders. Borderline personality disorder. People with borderline personality disorder often experience intense emotional fluctuations, relationship difficulties, impulsivity, and a fear of abandonment. Maintaining stable relationships can be challenging for them. Narcissistic personality disorder. This disorder is marked by an inflated sense of self-importance, a need for admiration, and a lack of empathy. People with narcissistic personality disorder may have deep-seated issues in relationships and crave attention. Antisocial personality disorder. Antisocial personality disorder is characterized by disregard for social norms, aggression, and lack of empathy. People with this disorder may engage in criminal behavior and have little regard for others' safety. 8. Neurodevelopmental disorders. Attention Deficit Hyperactivity Disorder, ADHD. ADHD begins in childhood and involves difficulty focusing, hyperactivity, and impulsivity. People with ADHD may struggle to concentrate on tasks and follow rules. Autism Spectrum Disorder. Autism encompasses a broad range of disorders that involve challenges with communication, social skills, and limited interests. People with autism often have unique ways of thinking and behaving, which requires understanding and support. Why it's important to understand mental disorders. Each of these disorders has unique characteristics and requires an individualized approach to treatment. Recognizing the symptoms and signs helps in taking better care of our mental health and providing support to others. Remember, seeking help from a professional is not only normal but also necessary. If you or someone you know is experiencing symptoms like those described above, don't hesitate to reach out to a psychologist or psychiatrist. Have you or someone close to you experienced these disorders? What was the experience like? Be sure to subscribe to our channel, like this video, share it with friends, and let us know in the comments what other topics interest you. Take care of your health and mental well-being.